I'm Carola Arndt. I'm a pediatric hematologist-oncologist at Mayo Clinic. Today we're going to talk about osteosarcoma. Osteosarcoma is the most common malignant tumor of bone in teenagers and young adults. It has an incidence of 5.6 per million children under 15 in the United States. Osteosarcoma tends to present or show up with symptoms of bone pain. Since nowadays teenagers are very active, in particular in sports, oftentimes the patients will present to their physician complaining of a swollen knee or pain in the knee or pain in the arm, and oftentimes initially it's thought that they probably just had a sports injury. And sometimes conservative management is undertaken with physical therapy or icing the knee or gentle range of motion exercises, but eventually when the pain doesn't go away, or if the pain is waking up patients at night, that is a clue to something more serious going on. Generally that then leads to an x-ray of the affected extremity, or either x-ray of the leg or of the arm or wherever the pain is, which tends to show a abnormality in the bone. Usually the abnormality on x-ray in osteosarcoma is called a sunburst appearance on the bone. And the reason it's referred to as that is that osteosarcoma is actually a bone-forming tumor, and sunburst refers to spicules of bone that look like a ray of sun coming out, rays of sun coming out from the bone. And really that's just the malignant new bone formation that's seen on the x-ray. Once patients have suspicion of a malignant bone tumor, they should best be referred to a center that has experience in treating patients with malignancies and malignant bone tumors. And there's a couple of reasons for that. First of all, it's best if you can do the diagnostic biopsy, and a biopsy means that you take a piece of the tumor to look at it under the microscope to determine what kind of a tumor you're dealing with. And it's best if that's done at the treating institution with the full cooperation and collaboration of the surgeons who will ultimately be doing the definitive surgery. The reason is that the surgeons can plan the operation around where the biopsy is done, so eventually they will ultimately excise the biopsy tract. Also, it's important with all the new biologic studies that are being done to be able to get enough tissue from the tumor to do specialized research studies on the tumor so that we can further our knowledge as to what are some prognostic implications in the specific biology of the tumor. So once we have a diagnosis confirmed, the next step then is to do a complete evaluation to determine if the tumor has spread to other parts of the body. Osteosarcoma most commonly metastasizes or spreads to the lungs, and so part of the evaluation is to do a lung CT scan. Obviously, we need to get detailed imaging of the affected bone, and that's usually done with an MRI of the affected bone. Also, we want to determine if the tumor has spread to other bones in the body, and so part of the standard evaluation would also consist of including a bone scan. Newer imaging techniques include PET scans, and more often PET scans are being used in the initial evaluation of a patient, and there is work being done in trying to determine if PET scans determine if in fact the rapidity of response of the tumor on PET scan is prognostic, and that's not clear yet. So PET scans are being used more and more in osteosarcoma and in other kinds of tumors also, but the standard evaluation would be the chest CT scan, an MRI of the affected bone, and a bone scan. Once we have the diagnosis, we then begin chemotherapy. Treatment of osteosarcoma is multidisciplinary, just like treatment of most childhood cancer. And for osteosarcoma, pediatric oncologists and orthopedic surgeons work very, very closely together. The usual approach to these patients is to give several weeks of initial chemotherapy, followed by surgical removal of the tumor, followed by an additional several weeks of chemotherapy. And with that multimodal and multidisciplinary treatment, we hope to be able to cure the majority of patients with osteosarcoma. At Mayo Clinic, we are members of the Children's Oncology Group, which is a 250 member institution group whose mission is to advance the cure of childhood cancer and understanding the etiology and the causes of childhood cancer. We participate in clinical trials of various types of cancer, in particular osteosarcoma, with the Children's Oncology Group. And currently we are actually participating in an international clinical trial called the EURAMOS study, which stands for European American Osteosarcoma Study, looking at different ways of treating patients with osteosarcoma. Specifically, one of the things that this study is looking at is to determine if changing chemotherapy after surgery in patients whose tumor is not adequately killed when you look at it under the microscope after some initial chemotherapy. So the question is whether changing chemotherapy in patients who have a poor response to initial chemotherapy can ultimately improve the prognosis. So that's one of the studies that we're currently participating in. For patients who have metastatic osteosarcoma at the time of diagnosis, there's also a separate clinical trial that we are participating in through the Children's Oncology Group, looking at the addition of zoledronic acid, which is a medication that has been utilized in helping prevent bone metastases in things like prostate cancer or breast cancer. And so we're looking at utilizing that in patients who have metastatic osteosarcoma at the time of diagnosis, in addition, of course, to standard chemotherapy. I think what's unique about coming to Mayo Clinic for evaluation and treatment of osteosarcoma is the multidisciplinary teamwork approach that we have to treating these patients. We oftentimes, most of the time, will see the patients together with the orthopedic surgeon. In fact, oftentimes on the same day, in the same room, and so the patient can ask both the surgeon and the pediatric oncologist questions so that both physicians are hearing the patient's concerns, and we can both attempt to answer the questions according to whatever our area of expertise is. Probably 90% or better of children with osteosarcoma are actually able to undergo limb salvage procedures. So most of the patients are able to have their leg saved or their arm saved, and there are many different techniques that the orthopedic surgeons use to do that, and time doesn't permit me to go into those today. However, we're certainly cognizant of the fact and make the patient cognizant of the fact that the most important thing is to save the patient's life. And saving the limb obviously is very, very important, but the most important thing to remember is saving the patient's life. And there are, unfortunately, a small percentage of cases where saving the life cannot be accomplished without doing an amputation. Fortunately, with new techniques in limb salvage procedures, that happens in the vast minority of cases. So most patients are able to have limb salvage procedures performed.